Bismillahirrahmanirrahim. Our first topic for today's practical is tetanus. Uh, Tetanus is a disease which I'm going to discuss today with all of you. So, starting from its etiology or causative agent, uh, you can see that it's this disease is being caused by Clostridium tetani. So you can see these on your left side. These are pus, stained pus from a mixed anaerobic infection. Uh, uh, and here you can see that almost three different type of Clostridia they are present here. This one, this one, this one. So on your right side, this is an electron micrograph of vegetative Clostridium tetani cells. You can see that these cells are, going towards the spore formation. So the causative agent for tetanus is Clostridium tetani. Talking about the morphology and physiology of this bacteria, we can say that it's relatively large and it belongs to gram-positive family. And you already have seen or observed the rod shape of this bacteria. Secondly, these are spore-forming bacteria and always multiply in anaerobic conditions, which are, without any air. So, Clostridia tetani, they are found in soil, especially wherever the soil is heavily manured. And it's also present in the intestinal tracts and feces of various animal species. Um, and one important aspect of this bacteria is that it is strictly fermentative, follows strictly fermentative mode of metabolism. Even under aerobic conditions, its metabolism won't work like under normal circumstances of anaerobic conditions. Regarding the virulence and pathogenicity of this bacteria, um, if we see the infection, actually, they do not cause any pathogenesis in humans and animals. If they are invasively infecting these host species, but there is a problem with this bacteria. It produces specific potent protein toxin. Two types of toxins are produced by this bacteria. The first one is tetanus toxin or tetanospasmin, and the second one is exotoxin, which is also known as tetanolysin. Its function still not known. Tetanus toxin, it is produced when spores they germinate and vegetative cells they grow after gaining access to wounds. So this is very important. The production of toxins occurs only and only when they gain the access to wounds. The organism, it multiplies locally and symptoms appear remote from the infection site. Only the infection site, shows the signs or symptoms of the tetanus disease. One of the three most poisonous substances, if we see on the weight basis, uh, like toxins of botulism and diphtheria. So among these three, this one is the first one, which is producing poisonous substances. Tetanus toxin is basically produced in vitro in amounts up to 5 to 10% of the bacterial weight. So we can understand I mean, if it grows under anaerobic conditions, then I mean, 5 to 10% of bacterial weight, it can produce a lot of toxin. And for a human, the lethal dose of Tetanospamin is almost 2.5 nanograms per kg of body weight. I mean, if it's below this level, it won't cause any kind of, symptoms. This toxin, it has a specific affinity for nervous tissues. That is why it is also known as neurotoxin. But it has no function, useful function, which is associated with this Clostridium tetani. Here you can see very clearly that if we see uh, that the toxin, it binds to the terminal nerve terminals, and starting from this is binding to the terminal portions of the nerves, and it is then transported within the axon and across this, and it crosses this synaptic junction until it reaches to the central nervous system. So it becomes rapidly fixed to gangliosides at the presynaptic inhibitory motor nerve endings. And then it's definitely taken up into the axons by endocytosis. So from the very beginning, it starts to block the release of inhibitory neurotransmitters, which are glycine and gamma aminobutyric acid, across the synaptic cleft, which is required to check the nervous impulse. And if nervous impulses cannot be checked by normal inhibitory mechanisms, it leads to unopposed muscular contraction and spasm that are the characteristics of tetanus. So this is the mechanism of this tetanus toxin, which is also known as neurotoxin. So method of transmission. First of all, it can live for years as spores in animal feces and soil. So as soon as it enters the human body through a major or minor wound and the conditions are anaerobic, this is a must. Spores, they start to germinate and release the toxins. And as their number start to increase by multiplication, definitely the level of toxin is which also increases. So tetanus may follow burns, deep puncture, wounds, ear or dental infections, animal bites, or like abortion. All these can be the source of this, the entry of this Clostridium tetani. Uh, and another important aspect of this bacteria is it can produces toxin only when it is growing. So it is the only vaccine preventable disease that is infectious but not contagious from person to person. So if we say that a disease occurs, it most of the time is contagious. I am sure everybody from you knows what is meant by contagious. So it is not contagious, and it can be prevented with the help of the vaccines. So whenever a person gets some abscesses or wounds by some sort of accidents, they are immediately administered tetanus vaccines. Actually, these are not vaccines; these are antidotes for these toxins. So, what are the symptoms while facing the tetanus disease? First of all, because the muscle start to contract, and it's very much painful for the body. So these are known as tetanic seizures. If the muscle spasm, they affect the larynx or chest wall, they may cause asphyxiation. I mean, the stoppage of breathing or low respiration rate, they all come into the asphyxiation. So stiffness of jaw, that's also known as lockjaw, stiffness of abdominal and back muscles, contraction of facial muscles, increased pulse rate, temperature, that is fever, and sweating. So you can see, I mean, here in the first picture above, the back muscles, they are more powerful, but the, I mean, still, even they are powerful, this kind of, toxin is creating the arc backward. And below is a baby. It has neonatal tetanus with complete rigidity, stiffness of the body. So there are different types of tetanus: local, cephalic, generalized, and neonatal. Actually, the incubation period is on an average at 8 days, and if you see, the range is 3 to 21 days. So uncommon types are local tetanus. For example, if it's persistent muscle contraction in the same anatomic area as the injury, which will, however, subside after many weeks. Very rarely fatal, milder than generalized tetanus, although it could precede it. Then comes cephalic tetanus, which occurs with ear infections or following injuries of the head, facial muscles, contractions. So the cephalic tetanus basically is focused on the head area. Then comes generalized tetanus. It has a descending pattern, starting from lockjaw to the stiffness of the neck muscles, then coming towards the difficulty of swallowing, then rigidity of abdominal and back muscles. They actually spasm continue for 3 to 4 weeks, and recovery can last for months. I mean, if you start to face these spasms, the recovery is very slow. So death occurs when spasms interfere with respiration. It is a definite, outcome of this disease. Then is a neonatal tetanus. The name indicates form of it's a generalized tetanus that occurs in newborn infants, which are born without protective passive immunity because the mother is not immune. So even in human beings, it is said that everybody, every individual should have been vaccinated with tetanus, so that especially the females, because if the mother is not vaccinated with this vaccine, it can, be transmitted from the mother to the neonate, and it may not have that passive immunity. So it usually occurs through infection of the unhealed umbilical stump, particularly when the stump is cut with an unsterile instrument. So definitely this condition is also, part of the that how neonates will get this tetanus. Uh, there are different methods for the diagnosis of this. It's very important diagnosis because sometimes uh, the the cultures of the wound sites, they are negative for Clostridium tetani 2/3 of the time, and when the culture is positive, it confirms the diagnosis of tetanus. For the culture of this bacteria in the lab, we require, need anaerobic conditions. So anaerobic jars, we use anaerobic jars for the for culturing of this bacteria. Um, Other tests which can be used for from the culture of the wound site, uh, but there is a chance, more than 50% chance that they may be negative, even if tetanus is present. Yes, and tetanus antibody test is, however, reliable, as more reliable as compared to the culturing. Other tests can also be used, but because during this tetanus attacks or spasm, these some of the symptoms are, common, like with meningitis, rabies, strychnine poisoning, or other diseases with similar symptoms. But these can be ruled out by using other tests. But in my opinion, tetanus antibody test is, far better than the culturing technique. So The treatment of this disease is very important in the early stage. If it's not sought in the early stage, this disease is often fatal. Bacteria are actually killed with antibiotics such as penicillin or tetracycline. Further toxin production is thus prevented. And then it's neutralized with shots of tetanus immune globulin, TIG, tetanus immune globulins. Other drugs, these can be provided like sedatives, which relax the muscles and relieve the pain in the individuals. So, due to the extreme potency of the toxin, immunity doesn't result after the disease. So, how we can prevent this disease? A person who is recovering from tetanus, it should begin active immunization with tetanus toxoid (TD) during convalescence. The tetanus toxoid is a formalin inactivated toxin with an efficiency of approximately 100%. So the vaccine includes tetanus, diphtheria, pertussis, toxoids. It is routinely given, especially in the developed countries. But even in Pakistan, we also administer this kind of vaccine to, to the kids or children. So after 7 years of age, only the toxin, tetanus toxoid needs to be administered because the antitoxin levels decrease over time. So booster immunization shots are needed every 10 years. Is there any possibility what we can do to prevent the prevalence or occurrence of this disease? Yes. First of all, remove and destroy the source of the toxin through surgical exploration and cleaning of the wound, that is known as debridement. If you are, dealing with this kind of individuals. So bed rest with a non-stimulating environment, dim light, reduced noise, and stable temperature, it is recommended. Sedation may be necessary to keep the affected person calm because the persons, they feel a lot of pain and they can't even rest properly. So sedation is important. Respiratory support with oxygen, it's in the extreme cases. Endotracheal tube, the mechanical ventilation, may be necessary. So this was all about tetanus. Uh, Thank you very much.